Hospital and the Hoag Medical Group and Hoag Physician Partners. The Hoag Medical Group and Hoag Physician Partners are an excellent team of doctors that provide internal medicine, family practitioners, doctors of osteopath, and they have an excellent team of specialists that treat over 48 specialties. My name is Derek Tarvin, and I've had the honor and privilege of working with Hoag Hospital for over 25 years as their outside insurance consultant. We have a family business in Costa Mesa and an office there located. We counsel everybody on all aspects of Medicare, Medicare options. We can help review your current coverage and compare that to your individual options. And today we'll be going over what is Medicare, the two main plan choices for Medicare coverage, which are the Medicare Supplements, also known as Medigap. We'll be talking about the Medicare Advantage plans, which can be a Medicare Advantage HMO or Medicare Advantage PPO. We'll be talking about the Medicare Part D prescription drug coverage, extra help, and various enrollment timeframes. So first of all, what is Medicare? Medicare, also known as Original Medicare, is health insurance for persons that are age 65 or over, and any of those that have received disability benefits for 24 months, or any age persons that have end-stage renal disease or Lou Gehrig's disease. Medicare has four different parts. Part A is your inpatient hospital service. Part B of Medicare is where all of your outpatient and medical services fall under. Part C is what they designate the Medicare Advantage HMO or Medicare Advantage PPO. And then Part D is prescription drug coverage. Only Medicare Parts A and Part B will ever show up on your red, white, and blue Medicare card. And there's an example on the screen of what your red, white, and blue Medicare card will look like when you receive it. Medicare Part A. Again, this is where your inpatient services fall under. Most do not pay a premium for Part A of Medicare. It was paid for you by payroll taxes or through your spouse through payroll taxes. It helps cover inpatient care in hospitals, skilled level of nursing care, hospice, and very limited necessary home health care. So Medicare Part B, this is where all your medical and outpatient services fall under. Most do pay a premium for Part B of Medicare. The standard premium for Part B of Medicare this year is $144.60, and it can vary depending on your income. The premium for Part B of Medicare is deducted from your Social Security benefits if you're drawing them. Otherwise, you'll receive a quarterly bill in the mail for your Medicare premiums. Part B of Medicare helps cover medically necessary home health care, medically necessary doctor services, outpatient care, tests, durable medical equipment, very limited home health care, preventative services, and more. Unfortunately, those that are higher income Medicare beneficiaries will pay more if you're Part B of Medicare. Social Security looks at your tax return on your modified adjusted gross, and they always look back 2 years. So for the year 2020, they look at your 18 tax return to determine what your Medicare premiums are. And those that file an individual tax return, and this 2 years ago, your modified adjusted gross was less than $87,000. And those that file a joint tax return, if your income was less than $174,000, you'll pay the standard Medicare premiums. If your income was higher than that, Social Security will charge you more for your Medicare based on what they call an income-related monthly adjustment amount, or the acronym is IRMA. And the different amounts that you can pay are up on the screen, and they go as high as what's on the next screen. And then Social Security, they will audit your tax return every year. So your Medicare premiums can go up or down based upon your filings. And obviously, if you're working 2 years previously before going on to Medicare, and your income has gone dramatically down, and they're basing your Medicare premiums on 2 years ago on your income, you can actually appeal to Social Security, and they may lower your Medicare premiums based on your current financial status. Otherwise, they will audit every year, and your Medicare premiums can go up or down. And unfortunately, the amounts that you're seeing now are going to be a little bit higher next year. The standard premium for Part B of Medicare for 2021 will be $148 and change. So it's going up a little bit, but not much. And it usually does go up, unfortunately, a bit each year. Okay. So enrolling into Medicare. Medicare usually starts on the first day of the month you turn age 65. If you're receiving Social Security or railroad retirement benefits, you'll automatically receive your Medicare card in the mail about 3 months before your 65th birthday. Or you'll automatically receive the card in the mail the 25th month of receiving disability benefits. If you're in these situations and you don't receive your Medicare card in the mail, you'll want to contact Social Security. And the telephone number is on your screen. And actually, they are open currently from 8 a.m. to 5:30 Monday through Friday Pacific time. If you need to call them, they're one of the better government agencies to deal with. They're very knowledgeable, very helpful, and usually very friendly. This time of the year, they're usually pretty busy. So if you call them, you may expect a long wait time. But I believe they have a protocol where you can leave your name and number and they'll call you back at the specified time. If you're not receiving Social Security or railroad retirement benefits, you actually must enroll with Social Security to get your Medicare card and get enrolled into Medicare. There's a couple ways you can do that. You can call them and they'll set up a future telephone appointment with you on the phone, or usually the easiest way is to just go online to medicare.gov. It's on the bottom of your screen. And in the middle of the home page, you click on Medicare Enrollment. Then I'll take you to another screen where you scroll down and then you enroll into Medicare. It's a pretty straightforward process. It takes about 10 or 15 minutes. If you have any questions or need help, I would advise contact Social Security. So there is an initial enrollment period for signing up for Medicare. You may enroll into Medicare 3 months before the month you turn age 65, which includes your birthday month, and up to 3 months after your birthday month. If you enroll within 3 months before your birthday month, Medicare will start on the first day of the month that you turn 65. Unless your birthday falls on the first, they actually backdated a month. Otherwise, you're eligible for Medicare the first day of the month that you turn 65. If you enroll during your birthday month or within 3 months after your birthday month, Medicare will start 1 to 3 months after signing up. If you miss the initial enrollment period, there is a general enrollment period for Medicare, and this occurs every January 1st through March 31st. If you enroll during this time frame, your coverage will start July 1st, and you may incur a late enrollment penalty. So those that are covered by a group employer plan, and employment is based on 20 or more employees, and you're covered under group insurance, you can actually delay signing up for Medicare A and B with no penalty. However, when employment ends or when group coverage ends, whichever happens first, you have 8 months to enroll into Medicare Parts A and Parts B with no penalty. So if you're working, you're covered by the group insurance, or your spouse is working and they're covered in the group insurance, there's more than 20 employees, you can actually delay signing up for Medicare A and B with no penalty. But whatever happens first, employment ends or group insurance ends, you'll have 8 months after that to enroll into Medicare A and B with no penalty. So those that are covered by employer-sponsored group health coverage and have Part A only, oftentimes if people are eligible for Medicare and there's more than 20 employees and they're covered under the group insurance, they may just enroll into Part A of Medicare because there's no premium for Part A, and then delay Part B of Medicare until such time as necessary. Again, however, when employment ends or group coverage ends, whichever happens first, that 8-month window to enroll into Part B of Medicare starts ticking. So you want to do that. Most people are going to coordinate their Part B of Medicare to start the day after their group insurance terminates. But if you have employer coverage and just Part A and you miss your initial window, you have 8 months to enroll into Medicare Part B with no penalty. And those that are covered by employer-sponsored group health coverage and then want to enroll into Part B of Medicare, there'll be 2 forms that need to be filled out. We have those forms in our office, or you can get them from Social Security's website. So if you have Part A and in the future you need Part B of Medicare, there will be 2 forms that need to be filled out. One you fill out, one you and your employer fills out, and you submit those to Social Security, and they enroll you into Part B of Medicare when such time is necessary. On the forms, there's no real date to put an effective date, but there is a remarks section. So if you need Medicare Part B to start, let's say March 1 of 21, you'll want to put that in the remarks section, send those 2 forms off to Social Security, and they will enroll you into Part B of Medicare. So those that have a health savings account contribution and you're covered under group insurance, and there's a contribution by your employer towards that health savings account, this is one time you may not want to enroll in Part A if you're eligible for Medicare, because it can jeopardize your health savings account contribution in some fashion. So if you have group insurance, you're still working, there's more than 20 employees, and you're eligible for Medicare, and you have a health savings account contribution, check with your human resource and benefits advisor to see if signing up for Part A will affect your health savings account. If you don't have any health savings account contribution, go ahead and enroll into Part A and then Part B in the future when such time is necessary. If you're covered under group insurance and there is less than 20 employees and you become eligible for COBRA, it's not on your screen, but if you're covered under group insurance, still working, and there's less than 20 employees and you become eligible for Medicare, usually at that time, Medicare becomes primary, and you'll want to enroll in the Medicare Part A and a Part B if you're working, covered under group insurance, and there's less than 20 employees. But always check with your human resource advisor or benefits advisor to see how Medicare coordinates with your group insurance. So those that are covered by COBRA, this is kind of a tricky one. COBRA is a continuation of your group insurance once employment has ended. And COBRA can usually runs a term of 18 months, sometimes up to 36 months in special circumstances. But if you're on COBRA and you become eligible for Medicare, you're going to want to enroll into Medicare Part A and a Part B, whether you stay on COBRA for the term or especially if you come off it, because COBRA is a continuation of group insurance once employment has ended. And employment has ended, so that's one of the 2 criteria to enroll in the Medicare A and B with no penalty. So if you are eligible for COBRA, you might want to take a look at the premiums because it can be very expensive, what the coverage is, and compare that to group insurance. But if you stay on COBRA, make sure you sign up for Medicare A and B within 8 months of your employment ending. So now we're going to discuss the 2 main coverage choices to go along with the original Medicare Parts A and Part B. There are the Medicare Advantage plans, which can be a Medicare Advantage HMO or Medicare Advantage PPO. With the Medicare Advantage plans here in Orange County for the HMO plans, most of them have a 0 premium. There are a few that have a very low premium, and the Part D drug coverage is incorporated into the benefits, so you do not need a separate policy. The other type of coverage we'll be discussing today to go along with the original Medicare are the Medicare Supplements, also known as Medigap plans. With the Medicare Supplement plans, you do pay a monthly premium, and the Part D drug coverage is not included, so you actually need to enroll in a separate Part D drug plan. And to enroll into either a Medicare Advantage or a Medicare Supplement, you must have Part A and be enrolled in Part B and paying your Part B premiums. So we're going to discuss the Medicare Advantage plans now. The Medicare Advantage plans can be a Medicare Advantage HMO or a Medicare Advantage PPO. They are also known as Part C of Medicare. Medicare Advantage plans combine your Medicare Parts A and Medicare Part D drug coverage into one plan. Most plans include extra coverage like vision, hearing, and most of them now include at least basic dental, and they do always have an optional dental plan that you can purchase that's comprehensive. So each Medicare Advantage plan has different costs, co-payments, co-insurance, and what they call yearly out-of-pocket maximums. That's the most you pay for your medical services in a calendar year before they cover you 100%. The yearly out-of-pocket maximums can vary, and the lowest one I'm familiar with is about $7.99 out of pocket for next year. And then the drug coverage, the Part D, is integrated into the benefits of the Advantage plan, so you don't need to purchase a separate policy. Prior authorization is required for certain services, and the plans do provide worldwide coverage for emergencies and urgent care. And the benefits for the Advantage plans can change every single year. So with the Medicare Advantage plans, the HMO type coverage, you must get your care from the plan's network of providers and hospitals, except for emergency and urgent care situations. With the Medicare Advantage HMOs, you select a hospital, a medical group, and a primary care physician from the plan's network providers in your service area. So with the Medicare Advantage HMOs, the insurance companies, like the umbrellas, they provide the medical benefits. And then there's many, many different medical groups that contract with the Advantage plan companies. Depending on what medical group you choose your primary doctor from will dictate what doctors and hospitals you have access to. So to make sure you receive all your services through Hoag Physicians, Hoag Facilities, you want to choose your primary care doctor from the Hoag Medical Group and the Hoag Physician Partners. And that way it will make sure you receive all your services through Hoag Hospital, the Hoag Facilities, and through the Hoag providers. And with the Medicare Advantage HMOs, you do need a referral to see the specialist. So always go through your primary doctor if you want to see a specialist. So with the Medicare Advantage plans here in Orange County, most of the HMO plans have a zero, and there's a very few that have a very low premium. You must be enrolled in Part A and paying your Part B premiums. With the Medicare Advantage plans, you'll have co-payments, or oftentimes zero co-payment, or co-insurance for authorized services received in-network or out-of-network providers when authorized. If you self-refer out of the network, or self-refer pretty much period besides urgent care or emergencies, you will usually pay full cost for non-authorized services. So make sure you go through your primary doctor with the Medicare Advantage HMO to see a specialist. And the Part D drug coverage is included into the plan, so you do not need a separate policy with the Advantage plans. They're all encompassing. So Medicare Advantage can be a Medicare Advantage HMO or a Medicare Advantage PPO. With the Medicare Advantage PPOs, you will use in-network plan providers or out-of-network providers that agree to accept the plan. Referrals are not required to see specialists with the Medicare Advantage PPO plans. You do pay a pretty sizable premium for the Medicare Advantage PPO plans, and then you will have plan deductibles you pay, co-payments, co-insurance for authorized services received in-network, and a certain out-of-pocket maximum you pay before they cover you 100%. And you will pay higher co-payments, higher co-insurance if you refer out of the network. And then the Part D drug coverage is included into the benefits, so you will not need a separate policy. So the other type of plan to go along with the original Medicare A and B that you can purchase is considered the Medicare Supplements, also known as Medigap plans. The Medicare Supplements and Medigap plans, they pay secondary to original Medicare. And with the Medicare Supplements, also known as Medigap, you can choose any doctor, any facility, or hospital nationwide that accepts Medicare patients. You do not need referrals to see specialists or authorization for procedures. Currently, the Medicare Supplement plans have 10 standardized plans that you can choose from, and they are sold by various insurance companies. And with the Medicare Supplement plans, different companies will charge different premiums for the same standardized Medicare Supplement plans. As I mentioned, you do pay a premium for the Medicare Supplements, also known as Medigap. The Part D drug coverage is not included in the benefits. With the Medicare Supplement plans, you actually must purchase a standalone Part D drug plan, and there's 32 different drug plans you can choose from, and we'll discuss the Part D coverage a little bit more in the presentation. The Medicare Supplement plans, what they call guaranteed renewal for life. They can never change the benefits of the plan or cancel it other than non-payment of premium. So the supplements, there's 10 standardized plans you can choose from. They range from plans A as in Apple to N as in Nancy. Currently, the highest coverage is Plan F. And unfortunately, anybody who's new to Medicare A as of January this year is not eligible for Plan F. But Plan G is the closest in benefits, and it just has a minor deductible that you pay. So we do have a Medicare Supplement comparison chart that we can email to you or forward to you. It's a very nice spreadsheet. It shows what your Medicare A and B benefits are, the various Medicare Supplement plans on there for comparison, and there's a lot of useful information on the back of the chart for the different enrollment scenarios. So now we're going to discuss the Medicare Part D prescription drug coverage. Medicare Part D drug coverage is available to anyone that has Medicare Parts A and or Part B. Medicare itself does not sell the Part D drug plans. To get a Medicare Part D drug plan, you actually must enroll into a plan. And there are two ways to get your Part D drug coverage. You can buy a standalone Part D drug plan that goes along with your Medicare supplement. And the various Part D drug plans are sold by various Medicare approved companies. The other way to get your Part D drug coverage is to enroll into a Medicare Advantage HMO or Medicare Advantage PPO that includes the prescription drug coverage into the plan. With the Medicare Part D drug coverage, all the plans have the same coverage model, whether they're a standalone Part D drug coverage that goes along with the supplement or the Medicare Advantage plans that have the Part D drug coverage. Each Medicare Part D drug plan has a different list of drugs that it calls a formulary, and the plans will place different drugs into different formulary tiers. And the plans can range from 1 through 6 tiers, maybe 1 through 5. Each tier has a different copayment or coinsurance amounts that you pay. For instance, a tier 1 generic would be your lowest copay, what they call a preferred generic. Tier 2 would be a generic. A tier 3 can be considered a preferred brand. A tier 4 can be considered a non-preferred drug classification. And then tier 5 and 6 are high-cost specialty injectable drugs that most people don't fall under. But again, each Part D drug plan will have these different various tiers they place your medications on, and each tier will have a different copayment. So as we mentioned, the Part D drug coverages all have the same stages or coverage model. They have 4 different stages for the plans. Stage 1 can be considered a deductible. Not all plans have a deductible. This year, the Part D deductible is $435. If you don't have a deductible or you meet the deductible, then for the drug plans, the Part D, you go into Stage 2, which is considered the initial coverage stage. And in the Stage 2 initial coverage stage, you will pay co-payments or coinsurance for the medications depending on what formulary tiers your drugs fall under, until the retail cost of the drugs this year exceed $4,020. If the retail cost of the drugs this year in the initial coverage stage exceed $4,020, then you go into the next stage, also known as the coverage gap and also known as the donut hole. Typically in the coverage gap, also known as the donut hole, you will pay 25% of the cost of generics or 25% of the cost of brand drugs until you reach the true relative out-of-pocket, which for all drug plans this year is $6,350. If the co-payments that you've paid for a deductible, any co-payments that you pay in the initial coverage stage, and when you're in the coverage gap, you're paying 25% of the cost of generics. That cost goes towards that $6,350 that you pay out of pocket. And for brand drugs in the coverage gap, you're paying 25% of the cost of brand drugs. And the manufacturer, for most prescriptions for brand in the coverage gap, contribute the other 75%. You're not paying towards that $6,350 out of pocket. So once what you've paid in the various stages and what you pay in the coverage gap and the manufacturer contributes towards that true relative out of pocket of $6,350, then you will go into the next stage, also known as the catastrophic coverage stage. If you reach this stage this year, you'll pay $360 for generics, $895 for brand, or 5%, whichever is greater, until the end of the calendar year. And then it all resets and you start back at the beginning. The drug companies will send you monthly statements where you're at in each coverage stage, and the pharmacy keeps track of that as well. And then every year, the plans will send you an annual notice of change usually in the September, October, showing you what your drug plan coverage has changed to for the next year. With the Part D drug coverage, we highly recommend reviewing your drug coverage every single year, because the drug plans benefits change every single year, whether you have a standalone Part D drug plan that goes along with the Medicare Supplement or the drug coverage with the Medicare Advantage plans. The benefits for the plans can change every year, and your medications may change as well. And whether they change or not, we highly recommend reviewing your drug coverage for the upcoming year We're in this time frame right now where you can review your drug coverage. It's called the annual enrollment or election period. We'll be discussing the enrollment period a little bit more in the presentation, but we highly recommend reviewing the drug coverage every single year. We get real busy in our office reviewing our clients' medications every year for the upcoming calendar year. So again, I can't stress enough how much you should review your drug coverage every single year. Unfortunately, those that are higher Medicare income beneficiaries that pay more of your Part B of Medicare, you will pay more of your Part D of Medicare as well, whether there's a premium involved or not. And it's the same threshold. Those that are individual filers from 2 years ago with less than $87,000, or those that file a joint tax return less than $174, you'll pay the standard Medicare Part D premiums. If your income's higher than that, you will pay more for your Part B and your Part D based upon your filings from 2 years ago. And again, they call it an income-related monthly adjustment amount. And the different levels you can pay this year are up on the screen, and they can go as high as what's on the next screen. And then again, they will audit it every single year. So your Medicare Part B as in boy and Part D drug coverage premiums can go up or down based upon your filings. There is a Part D late enrollment penalty. If you delay enrolling into Part D or have a break in continuous drug coverage for 63 days or more, and then enroll into a Part D drug plan later on, they will assess a late enrollment penalty. The penalty is not great. It's more of a nuisance. It is 1% of the national average base premium for every month you were eligible for coverage and did not have it. So if you go 24 months with a break in drug coverage and then enroll into Part D drug coverage, a 24% penalty will be assessed of the national average premium. The national average premium currently is around $35. So 24% of that is like around $8 and change. That $8 and change will be tacked on to any premium that you have for life. So it's a good incentive to enroll in a drug plan so you have the coverage in case you need it and don't get penalized later on for enrolling late. So there is a program called Extra Help, and this is a Medicare program that helps people with limited income or resources pay for Medicare drug costs, also called low income subsidy. And it can help pay monthly plan premiums, deductibles, co-insurance, and co-payments. If you think you qualify for this, we would recommend contacting Social Security and discussing your financial situation with them and see if you do qualify for the low income subsidy help. So there are various enrollment time frames enrolling into the different plan choices. There is an initial election period, turning 65 or new to Medicare. There is a special election period based on different scenarios, such as leaving employer-sponsored group health coverage, permanent moves, 12-month trial basis. We'll be discussing the annual election enrollment period that we're in currently. This occurs every October 15th through December 7th. And this time frame applies to Medicare Advantage plan members or Part D drug coverage only, not the Medicare Supplement plans. And then there's a new one, relatively new, we'll be discussing, which is the Medicare Advantage open enrollment period. And this is for existing Medicare Advantage plan members only. So the initial election enrollment period, turning 65 or new to Medicare, and you would like to enroll into a Medicare Supplement Medigap. You have what they call guaranteed issue, no health questions. They can't turn you down based on health for a period of 3 months before your Medicare Part B goes into effect, up to 6 months after your Part B goes into effect to enroll into a Medicare Supplement plan with no health questions. So if you're turning 65 or new to Part B of Medicare and you want to enroll into a Medicare Supplement, you can enroll 3 months, up to 3 months before your effective date of your Part B, up to 6 months after your Part B goes into effect with no health questions. So those that are turning 65 and new to Medicare and would like to enroll into a Medicare Advantage HMO or a Medicare Advantage PPO, you may enroll 3 months before your effective date of Medicare A and B, up to 3 months after the month you turn 65 with no health questions to enroll into a Medicare Advantage plan. Actually, this year, in the previous years, they do ask one health question for the Medicare Advantage plans, and that's if you have end-stage renal disease. That has been, and previously, only the only condition that the Advantage plans do not accept. If you have an Advantage plan and you develop end-stage renal disease, they will treat it. It's just you would not be able to switch it or enroll into a Medicare Advantage plan if you have that condition. Next year and the following years, they are eliminating that one health questions from the Advantage plan, so they will truly not have any health questions from the year 21 on. Those that would like to enroll into a Part D drug plan, you may enroll 3 months before you turn Medicare A and B goes into effect, up to 3 months after your Medicare A and B go into effect, and there's no health questions for the Part D drug plans. There are special enrollment or election periods, those that are leaving employer-sponsored group health coverage. And you're looking to enroll into a Medicare Supplement or Medigap plan. When your group employment ends, you have 63 days to enroll into a Medicare Supplement with no health questions. Unless you're new to Part B, then you have 6 months. So if your Medicare A and B has been in effect for years and you're coming off employer-sponsored group health coverage, you've got 63 days to enroll in a supplement, no health questions, or up to 6 months if you're new to Part B of Medicare. Those that are leaving employer-sponsored group health coverage and would like to enroll into a Medicare Advantage plan or a Part D drug coverage, instead of 63 days, you have 2 months. So if you're leaving employer-sponsored group health coverage and you would like to enroll into a Medicare Advantage plan or a Medicare Part D drug plan, you have 2 months once your group health coverage ends to enroll into a Medicare Advantage plan or a Part D drug coverage. Most people are going to coordinate their insurance to start the day after your group insurance terminates because we don't want to have a lapse in coverage. But in case you do happen to have a lapse, you do have these windows of 63 days to enroll in a supplement or 60 days, 2 months to enroll in a Medicare Advantage or a Part D drug plan. So there are other special election periods. If you are turning 65 and new to Medicare, and you enroll into a Medicare Advantage plan initially, they will give you a 12-month trial basis to try the Advantage plan out. If for any reason during the initial 12 months of being enrolled into a Medicare Advantage plan, you're not happy with it, or you simply want to enroll into a Medicare Supplement for whatever reason, they'll give you a special enrollment period anytime during the initial year, terminate the Advantage plan, and enroll into a Medicare Supplement and a drug plan with no health questions. Those that do have a Medicare Supplement in force now and join a Medicare Advantage plan for the very first time, they will give you a 12-month trial basis at that time to try out the Advantage plan. So if you have a Medicare Supplement plan and the premiums become cost prohibitive, the Advantage plans look attractive, which they do. They have very good benefits and there's no monthly premium. Anybody who comes out of a Medicare Supplement and tries an Advantage plan for the very first time, they will give you that 12-month trial basis as well. If you're not happy with the Advantage plan or you simply want to get your Medicare Supplement back for whatever reason, they'll give you a special enrollment period anytime during the initial year and enroll back into your Medicare Supplement with no health questions. Unfortunately, they don't give you both 12-month trial basis. They give you one or the other. And if you stay with the Advantage plan past that initial year, then they're going to lock you into the Advantage plan for that next calendar year, and then you may be subject to health questions at that time. There are other enrollment scenarios where you do not have to answer health questions going to a supplement. It's not on your screen, but if you move out of the plan service area, let's say you have an Advantage plan and you move to a different county or a different state, that will trigger an open enrollment to a supplement or an Advantage plan in that area that you move to. If the Advantage plan's premiums ever go up from zero, or the co-pays for the physicians or hospitals go up, or they pull a benefit away from the Advantage plan, or the Advantage plan terminates, then you have an open enrollment supplement the following year. So if you stay with the Advantage plan past the initial year, you may be subject to health questions unless those other triggers apply. So we're going to discuss now the annual election or enrollment period that we are currently in. And this is the time frame where you can enroll, disenroll, or switch a Medicare Advantage plan or a Part D drug coverage. And all Medicare beneficiaries can join, switch, or drop a Part D drug plan or a Medicare Advantage plan during this time frame of October 15th through December 7th. And if you make a change during this time frame, the new plan becomes effective or will terminate coming up in January 1. So this annual election period, we get real busy during this period reviewing our clients' medications and their coverage for the upcoming year. So if you're an existing Medicare beneficiary, we would highly advise reviewing your drug coverage and your benefits for the upcoming year for the Advantage plans. This one is relatively new. It is a Medicare Advantage open enrollment period, and this is for existing Medicare Advantage plan members only. If you have a Medicare Advantage plan in force, you can switch it during the annual enrollment period, which is October 15th through December 7th, or they have this new time frame, which really nobody knows about because they can't advertise this or target anybody. But if you have a Medicare Advantage plan in force, you can actually switch it between January 1st and March 31st once during this time frame. If you switch your Advantage plan during this time frame, the new Advantage plan becomes effective the following month. Another scenario you can use during this time frame is if you have a Medicare Advantage plan, you can disenroll, go back on original Medicare, and apply for a Medicare Supplement and enroll into Part D drug plan. So you can switch your Medicare Advantage plan once during this time frame, or you can go back on to original Medicare, apply for a Medicare Supplement, and enroll into a Part D drug plan. If you're going to use this scenario to apply for a Medicare Supplement, we would highly recommend applying for the Medicare Supplement first because they can and may turn you down based on health. And if you enroll into Part D drug plan, it will automatically cancel your Advantage plan out the following year. We don't ever want to leave anybody out of any coverage. So if you're going to use this time frame to go back on original Medicare, apply for a supplement, and enroll in a drug plan, we highly advise applying for the Medicare Supplement first, make sure you get accepted, and then enroll into a Part D drug plan, which will terminate your Advantage plan the following month. So I know we went over a lot of information. We'll be taking questions now. And if you ever have any further questions or need any assistance or help enrolling into insurance, you can always contact me at my office through the phone or shoot us an email. And so, yeah, we're going to be taking questions now. And so one of the more common questions we get is, should I enroll in a Medicare Supplement or a Medicare Advantage plan? Those that are used to self-referring want to retain that privilege, or you may have a lot of doctors and specialists that may not belong to a medical group with Advantage plans, or they may be spread out through many different Advantage medical groups and they're hard to navigate. Kind of gravitate towards a Medicare Supplement plan. The Advantage plans work just as well. There's a little more restrictive on how you access providers, but they're excellent benefits. There's no monthly premium for the medical or the drug coverage, and most of your co-payments are zero. In Orange County, they have very excellent benefits for the Medicare Advantage plans. And the Hoag Medical Group, if you have an Advantage plan and Hoag Physician Partners, that is the medical group you want to make sure you choose your primary doctor from through the Advantage plans to make sure you receive all your services through Hoag, the Hoag physicians, the Hoag facilities, and doctors. And I'm not sure if we have any more questions. Other than that, we look forward to hearing from you in the future. Please give us a call or shoot us an email. This presentation will be up online if you'd like to research the premiums and benefits and different coverages. And we thank you for attending, and you guys have a nice weekend. Thank you very much.
Okay, you're back up?
Yeah, hello again. So I guess we have a couple questions come in.
Did you say that right? I thought the advanced plan was the higher level plan, and I think you said it in reverse.
The question is the Advantage plan the higher level coverage, or maybe it was in reverse? The Advantage plans are just one type of coverage. They're not necessarily higher than a Medicare Supplement plan. They just work differently. With the Medicare Advantage plans, there's no monthly premium for the HMO plans here in Orange County. A couple have a very low premium. You do have a primary doctor that you see for all services, and then they refer you to the specialist. The Advantage plans usually have extra benefits than the supplements may have. The Advantage plans can cover acupuncture, massage, some of them. They do have some will give you a Fitbit. They do have the drug coverage into the benefits. They do have the dental that the supplements don't cover. The supplements, they range from Medicare Supplement Plan A to Medicare Supplement Plan N. There's 10 standardized plans you can choose for the supplements. And those do have lower or higher coverage. The most comprehensive Medicare supplement currently is considered Plan F as in Frank. The next highest coverage for those that are not eligible for Plan F is considered Plan G. With Plan F as in Frank, between your Medicare A and B being primary and the supplement being secondary, it's 100% coverage, it's full coverage. Plan G is almost identical. This year there's a slight $198 deductible that you pay with Plan G, and then you're covered 100% for a Medicare approved charge after that. So it's pretty close to Plan F. And then any plans above Plan G are actually, they're not higher coverage. So logic dictates with the alphabet, higher letters would be higher coverage, but F is the highest coverage and Plan G is the closest in benefits.
Okay. And then the next question was, I am a spouse and on the Hogue plan, do I have a different process than the employee?
The question is, I'm a Hogue employee. A spouse and I am a Hogue employee. Is enrolling different for me? I'm not quite sure as far as that means for enrolling into Medicare. If it does, and you can follow up if I'm not answering your question in detail, if you're working and you're covered under group insurance, it's still the same process to enroll into Medicare. You can do that online or give Medicare Social Security a call to enroll into Medicare Part A and Part B. If you're still working and you have just Part A of Medicare, or your spouse is working and you're covered under their group insurance, and you need to enroll into Part B of Medicare, it's the same process. There's two forms to fill out. One you would fill out, one you and the employer fill out, or one you'd fill out, and one your spouse's employer would fill out, and you submit those to Social Security, and they enroll into Medicare. As far as the individual Medicare options or plans to go along with the original Medicare, it's the same procedure. You would either enroll in a Medicare Supplement plan with a standalone Part D drug plan, or Medicare Advantage HMO or Medicare Advantage PPO. If I didn't answer your question in detail, please contact me and we can go into more detail with you.